Okay, well, good morning. My name is Kathy Kelly Ballinger. I'm the Recreation Manager for the City of Reno. Would like to welcome you. I'm here in the place of April Wolf, who's at a conference today. And I wanted to introduce our today's speaker, Dr. Melanie Ginsberg, who is a clinical pharmacy specialist in pain management at the VA Sierra Nevada healthcare system, and she's going to be discussing safe opiate use in spinal cord injury. And we have construction here, so sorry about the craziness going on in the background. Melanie, take it away.
Good morning, everyone. I'm going to share my screen. Let me know that you can see it. Okay, great. Let me get my screen set up. 1 second. Okay, let me stop sharing and get my screen set up and I'll reshare. Okay, I think I have it now. Let me try this again. All right, can you see it? Perfect. All right. I am going to do my presentation. I won't be able to see the chat. So if you do have questions, you can either interrupt me or pop the questions in the chat, or you can ask me at the end of the presentation. Either way is totally fine with me. Good afternoon, everyone. My name is Melanie Ginsberg, and I am the Academic Detailing and Pain Clinical Pharmacy Specialist here at the VA Sierra Nevada Healthcare System in Reno. And today I'll be giving a brief presentation on safe use of opioids in spinal cord injury and the naloxone nasal spray rescue kit. Before going into naloxone specifically, I wanted to give a brief background on pain management and spinal cord injury itself. Chronic pain is common in spinal cord injury or SCI patients, as I'm going to refer to it from here on out. Classifying chronic pain in SCI can be difficult, as is true for chronic pain in general. And this is because pain can be due to a variety of reasons, such as musculoskeletal pain, nerve pain, fibromyalgia, or many other types of pain that patients may experience. And knowing the type of pain is important for providers to treat and use the appropriate medications for treatment. There are several types of medications that are recommended for both musculoskeletal pain as well as nerve pain, which tend to be fairly common in SCI. For musculoskeletal pain, physical therapy is recommended first line, along with non-steroidal anti-inflammatory drugs or NSAIDs. These include ibuprofen or Advil and naproxen or Aleve. And then we also have acetaminophen or Tylenol, and muscle relaxers for patients who are experiencing muscle spasms. These include methocarbamol, baclofen, or cyclobenzaprine. For nerve pain specifically, our first line medications are tricyclic antidepressants or TCAs, and these include medications like amitriptyline or nortriptyline. Then we also have other options such as gabapentin, pregabalin or Lyrica, or SNRIs, which are a class of antidepressants. And in this class, we typically use venlafaxine or duloxetine for pain management. Second line recommendations include opioids, and that is where the focus of the rest of our presentation today is going to be. Opioid safety is key when prescribing these medications, so I wanted to spend some time discussing key points on this topic. I also wanted to mention that some of the information I covered today is veteran specific in terms of statistics, but the information is relevant to all and can translate to anyone in the audience. Opioids are medications that are used to treat pain, sometimes cough, as well as addiction. Examples of opioids include hydrocodone, morphine, fentanyl, and heroin. And opioid overdoses occur when a person takes more opioids than the body can handle. This slows or stops their breathing and can lead to death. Overdoses can be accidental or intentional. Among veterans in 2017, 6% of overdoses were accidental. And synthetic or man-made opioids like fentanyl comprise more veteran overdose-related deaths, with an estimated 56.9% in 2017. The figure on the right shows the risk of opioid overdose for non-veterans and veterans, including intentional and accidental overdoses. And as you can see, the number is much higher for veterans compared to non-veterans, but is still significantly high for all of the groups that are shown there. I've listed some important information in regards to safer opioid use for you here. The first point to always know is that there is no safe opioids. So for years, prescribers were taught their patients that there were some medications in the class of opioids that were perfectly safe to use. And it was okay to prescribe no matter what the indication was for, how much you were prescribing, how often the patient was taking. It was okay to prescribe those medications and to increase the dose or the frequency as much as you needed to until you got that analgesic effect. But we know now that that's not the case, and that opioids have significant safety concerns, even if you're prescribing them at the lowest dose. It's important to start with a low dose if you do need to use an opioid, and to increase that dose slowly, particularly because patients do develop tolerance to these medications. And so their body may adapt and might need higher doses over time. So starting with the low dose will allow their body to get used to the medication, and then over time you can increase if needed. It's important to avoid mixing opioids with alcohol, benzodiazepines like clonazepam or alprazolam, or other medications that can make you sleepy. In some cases, this can lead to an overdose, and often those are accidental. And finally, naloxone is a medication that can be used to reverse the effects of an opioid overdose. And that's what I'm going to focus on for the rest of the presentation today. I wanted to go over the naloxone rescue kit and how you can actually use this medication in case you ever do come across it or need to use it for yourself or someone else. It is a nasal spray, and it comes in a package of 2. And you can see in the picture to the right the size of one of these sprays. I wanted to also mention that this is specific to Narcan, which is the 4 milligram spray. And within the last week, the FDA has actually approved a higher dose, which is an 8 milligram spray. And its brand name is Clodexo, which is a newer brand of this medication. And so it's still a nasal spray. It looks the exact same. The dosing is just a little bit higher. There are 2 different ways I like to discuss naloxone with patients. So the first is a fire extinguisher. I like to relate it to either of these things. The first is a fire extinguisher. So you hope that you never have to use it, but it's always good to have it around in your house for emergencies just in case. And then the second is an EpiPen. So if I know that a patient is prescribed an EpiPen for allergies, I'll use this as an example. So many patients already have a prescription for an EpiPen for allergies. And I like to compare it to this. So you always carry your EpiPen around just in case you encounter an allergy that you weren't anticipating. And I recommend doing the same thing for a naloxone kit. You always want to keep it with you just in case you encounter a situation that you weren't anticipating, whether it be accidental overdose for yourself or whether you come across someone else that you think may have overdosed. You can always use that on them as well. It's also important to discuss signs and symptoms of opioid overdose so that patients and caregivers alike are aware of what to look for. These are just a few. So pinpoint pupils, or those really, really small pupils, falling asleep easily, particularly like if you see somebody in a doctor's office and they can't keep their head up, or they have fallen over maybe while they're walking somewhere, or they're leaning up against a wall and you see them fall out. Loss of consciousness, slow or shallow breathing, so their chest won't fully rise, choking or gurgling sounds, and then finally pale, blue, or cold skin. That is a telltale sign, and it typically happens around their mouth or their extremities, like their fingertips or their toes. This is a brief overview of how you give naloxone. We want to make sure that we first call 911 because we want emergency services to get there ASAP. And then the naloxone can help until emergency services can get there. So you first remove the naloxone nasal spray from the box and peel back the tab with the circle on it. Hold the nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle, just like you would any other nasal spray. And you want to tilt the person's head back to make sure that they can get the medication into the nostril and support the head and neck. Insert the nozzle into one nostril until your fingers are against the bottom of their nose, and then press the plunger to give naloxone and remove. There are 2 instances in which you could give the second dose of naloxone. So like I said, there are 2 doses in the box. Each nasal spray only comes, or each nasal apparatus only comes with 1 spray in the nasal kit. So you want to make sure you don't prime it. You're not, trying to make sure that it works, because then you'll use that dose. So if you needed to use the second dose, it would be if the person doesn't start breathing within 2 to 3 minutes after you give the first dose, then you would give the second dose. Or if naloxone wears off after 30 to 90 minutes. So a second dose might be needed if, say, you live in a rural area, you give the first naloxone dose and EMS still hasn't gotten there. You may need to give the second dose until they can get there to the patient. You always want to stay with that person until emergency services can get there, or for at least 90 minutes, just to make sure that they don't stop breathing and that they don't need that second dose. And then some important information, like I said, there are 2 doses in the kit, so you always want to make sure you keep both of them with you. If you ever use one and you don't need to use the other one, then you would want to ask your provider or your pharmacist for a refill and make sure you can have 2 at all times. Make sure you store it at room temperature. So trying not to leave it in a hot car or in a very cold environment. Say, you're out and about, you want to make sure you leave it. If you are going to leave it in the car, that it's not for an extended period of time, or you keep it in your purse if you carry a purse. If you use one or both nasal sprays, or if they expire, make sure you contact your provider for a replacement. And then make sure that you don't prime the nasal spray, because like I said, there's only 1 dose in each one. And I'm going to try to play this video for you guys and see if it will work. This is a veteran testimony from when they had to use naloxone and just the impact that it had on his life. Let me know if you can hear it as well.
To this day, people, I tell people my story and they're blown away because they're like, you served your country for half of your life. 40 years old, you served half of your life. And you're like, how can you be a hero? Miraculously, like that morning, being an outreach worker, who had given him all my life for that. On the flip side, I've saved people. I've watched people, come from death back to life in a matter of days. Some people feel that giving the addict access to Narcan increases the desire to use heroin, which is ridiculous. The desire to use heroin is inside the addict one way or the other. We need to get this in the hands of as many people as possible. Sitting here speaking to you, I am the evidence. I know hundreds of other people that are the evidence.
And I really like this video because not only does he talk about the time that he was saved from the medication being used on him, but also how he's had to use it on other people. And I always advocate for our patients in the VA and also for just friends and family to try to have the medication on hand at all times. And within Nevada, as a state, you can request having the medication available to you from a pharmacy. You don't have to have a prescription from your primary care doctor. You can ask your primary care doctor for a prescription, but if you don't feel comfortable doing that, or you don't see your primary care doctor often enough, you can go into a CVS or a Walgreens and ask them for a naloxone nasal spray kit. It is held behind the counter, but it's considered an over-the-counter medication, similar to like Sudafed. So you can ask for a prescription for that, or a nasal spray kit without the prescription, and they should be able to give that to you from the pharmacy there. So I always recommend having that, because you never know, even if you aren't using an opioid prescription, you never know if you might come across somebody that may have an overdose, and you could save their life from having that medication on hand. That is the end of my presentation. I'm happy to take any questions that you guys may have.
If anyone has questions, you should just be able to unmute and ask your questions of Melanie. Well, I'm not seeing anything. So I'd like to thank everyone for attending. Thanks, Melanie. We really appreciate it. And you have a message thanking you for the presentation. And we'd like to thank the VA Sierra Nevada Healthcare Systems, Renowned Health, and High Fives Foundation, our co-sponsors of our Lunch and Learn. Okay. I don't think there's any other questions. So thank you, everyone, for being here today.
Thank you.
Bye-bye. Thanks. Yes, sir. Appreciate it.
Of course, happy to help. Anything else you need from me at the moment in time?
I think you can complete the meeting now. Close it. Thank you.
Thank you. Have a good day.